When a modern medical clinic operates at peak efficiency, it relies on platforms like Allscripts to manage everything from prescribing to the revenue cycle. The software itself is capable. The friction comes from the people required to manage its complex workflows, who are currently stretched thin, burned out, and cycling out the door. You see the cracks show up in specific ways. Billing backlogs pile up, clinical documentation gets delayed, and patient care quietly erodes. Electronic health record systems require significant human bandwidth that most practices simply cannot sustain. The AMA's 2024 survey shows an average physician workweek of 57.8 hours. Notice how it divides. Only 27.2 hours involve direct patient care. The remaining 20 hours are consumed by indirect care. Doctors are tied up with order entry, referrals, and prior authorizations. A 2025 Tebra survey ranks the top drivers of physician burnout, with documentation and charting extending past every other category. The daily ratio is punishing. For every 15 minutes spent face-to-face with a patient, physicians lose 9 minutes to data entry. Because that ratio makes it difficult to finish charting during business hours, doctors are forced into pajama time, spending their evenings catching up on EHR tasks, which threatens their personal well-being and the stability of the practice. The strain hits the front office staff just as hard. Even well-run practices struggle to keep trained Allscripts specialists seated long enough to become productive. MGMA data tracks attrition rates for medical administrative staff, peaking at a 40% turnover rate for frontline roles. Every departure hits the budget. Replacing a frontline staff member costs the practice up to $30,000. Mid-size practices struggle to hire their way out of this trap, especially when market wages for accounting roles have spiked over 50% since 2015. Traditional merit increases do not keep pace. The traditional in-house staffing model creates a revolving door that drains institutional knowledge and practice revenue. Instead of trying to fill empty seats, administrators are shifting the work outward, moving away from in-house hiring in favor of dedicated external teams. Staffingly provides the infrastructure for this shift. They already operate this model across more than 800 healthcare providers nationwide. A dedicated external team offers a structural advantage over a single employee. The specialists work directly inside your existing software with real-time access, meaning there is no single point of failure if someone is absent. The speed of implementation is different. While in-house hiring and training processes typically drag on for weeks, an external team handles initial onboarding and is live in your system within 48 to 72 hours. This shift replaces a fragile single point of failure with a permanent operational lifeline. These external teams bring an additional advantage to the table. They enhance human specialists with AI-powered workflow tools. One key feature is an intelligent priority engine. As you can see in this dashboard interface, a list of incoming medical tasks is sorted into clean, color-coded priority tiers based on urgency and deadline, removing the need for manual triage. At the same time, pattern recognition algorithms monitor the workflows, catching recurring data entry errors and flagging them before they can lead to billing delays. These dedicated specialists use high-precision tools to achieve speeds and compliance rates that overloaded in-house teams often miss. To judge the value of this model, administrators have to look closely at the fully loaded cost of an in-house Allscripts specialist. This chart breaks down the math. Watch the left side build, stacking salary, benefits, taxes, and turnover penalties. A single in-house position costs $60,800 a year. On the right, the outsourced model locks in at $21,600. That is a 64% cost reduction. It returns over $39,000 in annual savings per position back to the practice's budget. By removing the financial bloat and operational fragility of internal hiring, outsourcing EHR support becomes a mathematically sound strategy for practice administration.